Good morning, students. We are continuing with the previous class. So, in the previous class was the introductory part of research design. So, in that we have discussed mainly about the two research approaches, qualitative approach and the quantitative approach. What is a research design and what are the different factors which we have to remember for selecting a good design, and what is a good design, how it looks like, and what are the characteristics of a good design, and intervention, that is a single most factor which determine the selection of a design. So these are the important points we have discussed in the previous classes. Today we are going to discuss about the types of research designs or the classification of research design. So this research design, as I mentioned before, it is coming under the two broad category, that is the quantitative approach and the qualitative approaches. Now this the several classifications are there. The first classification of research design, this is basically based on the behavioral or sociological scientists. So they classify research design based on some factors. The first factor they have considered is based on the control over independent variable, because we know that we have learned there are two type of variables, independent variable and dependent variable, and the researcher is most interested in dependent variable, whereas they make changes in the independent variable and see what are the changes that are taking place on the dependent variable because of the measured changes in the independent variable. So this is the importance of independent and dependent variable, or in other ways the cause and effect. Cause is the independent variable and effect is the dependent variable. So based on the control, how much control is there for the researcher over the independent variable, we classify into three. These are the experimental research, quasi-experimental research, and non-experimental research. As the name indicates, experimental research means that is 100% control is there over the independent variable. Without the knowledge of the researcher, nothing will happen. Even a small minor fluctuations, changes is not possible because everything is under the strict control of the researcher. Even independent variable, extraneous variables, everything is fully controlled by the researcher. So that is the experimental research. Whereas the second type is a quasi-experimental research, where some flexibility is there or some elements of true experimental research will be missing, especially one element will be missing. That is a quasi-experimental research. Then there is one more addition is there that is not mentioned in the classification, is the pre-experimental design. That is the addition now, pre-experimental design, where two among the three elements of experimental research will be absent. Only one element will be there, that is the intervention. That is the only thing that is present in the pre-experimental research, and none of these elements will be present. All three elements will be absent in the non-experimental research. That means there is no absolute control over the independent variables. So from experimental to the quasi-experimental to the pre-experiment to the non-experiment, when it progresses, the amount of control over the independent variable decreases. Okay, so this is based on the control over independent variable. We classify research into experimental research, quasi-experimental research, pre-experimental research, and non-experimental research. Now the second thing is based on the degree of structure. We classify into two: structured research and flexible research. There are some researchers by the make itself is structured. I mean, that is highly rigid. All the steps are clear cut. Everything is very well planned. Minor fluctuations is not possible. Even the non-experimental research also can be a structured research if it is very well planned and executed. Even some minor fluctuations or change is not allowed. So that type of research we call as structured research. Whereas flexible research allows some form of changes. It is flexible. And why the flexibility is not for the ease of research or not to make the research into very simple, but to increase the or the improve the quality of research. Because of the flexibility, we'll get more quality data, more in-depth data because of the flexibility. Let's take for example, in a historical study, we plan someday, everything is planned, but at the time of data collection only we identified another person who know more about the history. So we'll include that person also. When we talk to that person, we came to know that another person is having another important document related to the history. So we contact that person because the flexibility improves the data quality and improve the scientific nature of the data, and the study become more scientific, more dependable, more replicable because of the flexibility. So that is why we choose flexible research. That is not to make the researcher to do things easier. Okay, so this is based on the degree of structure. We classify research into two: structured research and flexible research. And the third thing is based on the types of group comparison. We classify research into two: between the subject comparison and within the subject comparison. Whereas in the previous class also we have discussed about the different type of comparison in research. So we can compare between the subjects from one study to another study. For population in India to population in Pakistan. So this is comparison between the subjects, and we can compare within the subject also. Same subject at a different period of time, or within the group itself we can compare. For example, the third year BSc Nursing 25 and 25. That comparison, that is also within the group comparison. Within the subject comparison means the same subject at a two point of time we compare. For example, before exercise and after exercise. So these type of comparison. So based on the comparison, we classify research into two: comparison between the subjects and comparison within the subject. And the fourth type of research designs are based on the number of data collection points. How many times we collect data. If we are collecting the data at only one point, this is called as a cross-sectional study. And if you collect the data at many times, it called as the longitudinal study or a progressive study. So cross-sectional study, as the name indicates, when we take the cross-section of a plant, we will see only at one plane, one point. Similarly, cross-sectional study is the study conducted at one point of time. We collect data and we will stop. What is that present situation? We explain. Okay, so but the longitudinal study is a continuing study we have several follow-ups. We collect data at more than one point of time, and so we get a multiple data. We are able to compare data from one time to the second time or third time, etc. We will be able to compare, and we'll discuss the detail later. So based on the number of data collection points, we have cross-sectional studies and longitudinal studies. Then the fifth classification is based on the occurrence of independent and dependent variable. When that is occurring, we classify research into retrospective studies and prospective studies. So when the occurrence of independent variable and dependent variable, based on that. So what is retrospective? As the name indicates, this is a backward study. Now we start from present and travel to the past. What happened before? That is a retrospective. Okay, so we are traveling backwards and see what happened. We have some effect at present. What is the cause of that? For example, we have lung cancer at present. What is the reason? What is the duration of smoking, or what are the other exposures are there? So we are trying to find out the cause. So that is a retrospective study. Whereas the prospective study, we start from the present and go to the future. That is from the effect, and from the cause we'll start and try to find out the effect of that cause. Okay, so that is prospective study. So one is retrospective, going backward, and one is prospective, that is going front into the future. So this is the two classification. Then finally, based on the purpose of the study, why we are conducting the study, we have three types of studies called basic research, applied research, and action research. So what is the purpose? Whether we want to explain something, whether we want to develop a theory only, or we want to test a theory, whether it is for an immediate practical application. There is a problem, immediately we want to solve the problems. So based on that, we classify studies into basic research, applied research, and action research. So this is the first classification. So I'll repeat it once more. Epidemiologists or the behavioral psychosocial scientists classify research based on several factors. Based on the control over independent variable, we have three types of research: experimental research, quasi-experimental research, pre-experimental research, and non-experimental research, 4 types. Based on the degree of structure, we classify research into structured research and flexible research. Based on the type of group comparison, between the subject comparison, within the subject comparison, based on number of data collection points, classify into cross-sectional studies and longitudinal studies. Based on the occurrence of independent and dependent variable, we classify into retrospective study and prospective studies. Based on the purpose of study, we classify into basic research, applied research, and action research. Now we go to the next classification. This is mainly used by the nursing teachers in the nursing literature. For example, if you take any of the nursing textbook, they basically classify into quantitative designs, qualitative design, and mixed design. So this is basically derived from the research approaches. Quantitative approach, quantitative designs; qualitative approach, qualitative design. If both the characteristics are there, we start from the quantitative, end with the qualitative, or start from quality and end with the quantity, or a mixture of alternate quantity, quality, quantity, quality, we that call as a mixed design. So these are the 3 designs in nursing literature: quantitative design, qualitative design, and the mixed design. And there are so many subtypes. This is the major headings are there under quantitative, under qualitative, and under mixed designs. These are some of the quantitative design, as I mentioned before, where in the previous classification we have discussed about the how much control is there over the independent variable we classify. Now the quantitative design as per the nursing literature include true experimental design, quasi-experimental design, as I mentioned, pre-experimental design, and the non-experimental design. So I have explained about what is true experimental, what is quasi-experimental, what is pre-experimental, and what is non-experimental design along with the previous classification. Now next we'll see the qualitative design. Qualitative design, we have discussed about the comparison between quantitative approach and the qualitative approach. I mean, same thing is applicable in the design also, quantitative design and the qualitative design. Qualitative design, as we have discussed before, basically it is a narrative form of research. We developed so much themes by conversation with the subject. So these studies will be done basically on human subjects. We have to communicate with them, and we collect data only from limited number of subjects till we achieve the data saturation, till we get the same response from the clients, we stop our data collection. So the first subject we start, the second subject and third subject give the same reply, we will not continue further, because we know that if further exploration we get the same data, that we do not need. If the variability is not there, we will not continue with the data collection, we'll stop there, and we try to evolve themes out of that by thematic analysis. What are the important themes we are getting? For example, they are talking about very sad thing, so sorrow is the theme, or depression is the theme. They're talking about pain, agony, etc. So pain is a theme that we are deriving out of their conversation. So we say that pain is a theme supported by the verbatim this, or the dialogue this. So this is how we derive themes out of qualitative designs. So there are different type of qualitative designs are there. Ethnographic design, phenomenology design, grounded theory, historical research is debatable, case studies, narrative analysis, qualitative outcome analysis, secondary analysis, critical theory, feminist research, participatory action research, descriptive qualitative studies. So these are some of the examples of qualitative designs. I'll repeat once more: ethnography, phenomenology, grounded theory, historical research, case studies, narrative analysis, qualitative outcome analysis, secondary analysis, critical theory, feminist research, participatory action research, and descriptive qualitative studies. So this is basically based on the narrative data, qualitative data that we are collecting from the human subjects. Now, mixed design means we are collecting data. The characteristics of both quantitative design and the qualitative design will be there. So qualitative phase followed by quantitative phase, or qualitative phase followed by quantitative, and the vice versa, or sometimes the mixture of quantitative, qualitative. So any type of mixing can be done. So this is a mixed designs. But for the namesake, there are these type of examples. Both the characteristics are there. That's why we classified some of the designs into mixed designs, like clinical trials, evaluation research, outcome research, survey research, secondary analysis, meta-analysis, Delphi surveys, methodological research, and need assessment studies. These are some of the examples of mixed designs. So till now we have discussed about the classification of research design. First we have seen the classification by the epidemiologists, mainly the behavioral scientists or the psychosocial researchers, how they classify research design. And second thing is from the nursing literature, that's mainly into quantitative, qualitative, and mixed design. And then we have discussed about the quantitative designs, mainly the 4 type of quantitative designs and several type of qualitative designs and the mixed designs. The details we will discuss one by one in the following classes.